Well, there's warnings that the province, Gauteng, will emerge with the highest numbers in the coming days. It's currently nearing 37,000 infections. Professor Francois Fence from Wits University speaks to us about these very concerning numbers. So we touched on it briefly with Angelique, but it really is a concern, isn't it, for so many factors?
That's right. I think that, Gauteng is the most populous province, also the most densely populated. It's a respiratory virus, so it naturally will spread much quicker in places which are densely populated, which is pretty much Joburg, Pretoria, and the whole province, actually. We also see that respiratory viruses tend to affect Cape Town before coming across the rest of the country by a couple of weeks. So this is completely predictable. I think we were all hoping it wasn't going to happen, but it seems to be happening as we speak.
And what can we learn from the Western Cape?
It's very late to be learning lessons now. We've had 3 or 4 months to prepare for this. So I think that what we can anticipate is a sudden, rapid increase in hospitalizations and demands on high care facilities and ICUs. So, yeah, I guess at this point is just try and make sure the public understand what to do when you start getting sick.
All right. And your comment on what's happening in the taxi industry. They're rightfully upset with the government, but they're now saying that taxis can operate at 100% capacity. What sort of impact do you think that'll have on our numbers here?
I just think it's insanity that we are, again, 3-4 months in and we're only having these discussions now. I believe that public transport might be one of the, if not the major ways in which the transmission is happening within South Africa. And we should be, there are real things we can do practically with the public transport, particularly with the taxi industry, that can make people a lot safer. Filling the taxis, closing the windows during winter are just a recipe for disaster. We really can do a lot better. So I can't talk to the politics of dealing with the taxi industry, but certainly this is, from a public health perspective, is an absolute disaster.
And what we learned this morning as well is that we don't have enough facilities here in Gauteng, that there are some hospitals that are so packed already that COVID-19 patients are sleeping on the floor. We don't even have field hospitals. I just don't know what people have been doing for the last 3 months. This is appalling. I had reports this morning of ambulances being turned away from hospitals with people who are sick and being moved from hospital to hospital. So the Department of Health just has to do something. And also what's worrying me is that there have been several whistleblowers that have been suspended and then reinstated. But healthcare workers are now terrified of speaking up because they're terrified they're going to be suspended and lose their jobs. So we've got this terrible situation where families are not in the hospitals because of quarantining, to be able to tell the stories of what's happening within the facilities. And on the other hand, you've got healthcare workers who are witnessing this, who are too scared to speak out. So this really is not a good situation. Oh. All right, Francois, thank you.